Peptic ulcers, also known as gastric ulcers or duodenal ulcers, are a common medical condition that affects the lining of the stomach or the upper part of the small intestine. These ulcers result from the erosion of the protective mucosal lining, leading to open sores. While once thought to be primarily caused by stress and diet, our understanding of peptic ulcers has evolved, revealing a multifaceted interplay of factors that contribute to their development. Causes of peptic ulcers. 1. Helicobacter pylori infection. One of the primary causes of peptic ulcers is infection with the bacterium Helicobacter pylori, H. pylori. This spiral-shaped bacterium can weaken the protective mucus coating of the stomach and duodenum, making it more susceptible to damage from stomach acid. H. pylori is a prevalent bacterium, and infection often occurs during childhood. However, not everyone infected with H. pylori will develop ulcers, indicating that additional factors play a role. 2. Nonsteroidal anti-inflammatory drugs, NSAIDs. Long-term use of NSAIDs, such as aspirin and ibuprofen, can contribute to the development of peptic ulcers. These medications interfere with the stomach's ability to protect itself from digestive acids, increasing the risk of mucosal damage. 3. Excessive stomach acid production. An imbalance in the production of stomach acid can contribute to the formation of ulcers. Conditions like Zollinger-Ellison syndrome, which leads to excessive gastrin production, can result in increased acid secretion, damaging the mucosal lining. 4. Smoking and alcohol consumption. Smoking and excessive alcohol consumption have been identified as risk factors for peptic ulcers. Both can exacerbate existing ulcers and hinder the healing process. Symptoms of peptic ulcers. The symptoms of peptic ulcers can vary, and some individuals may not experience noticeable symptoms. Common signs include burning or gnawing abdominal pain. This pain is often felt between meals and in the early hours of the morning when the stomach is empty. Nausea and vomiting. Some individuals may experience nausea, and in severe cases, vomiting may occur. Loss of appetite and weight loss. The discomfort associated with peptic ulcers can lead to a reduced desire to eat, resulting in weight loss. Bloating and belching. Excessive gas and belching may occur, contributing to abdominal discomfort. Bloody or dark stools. Bleeding from the ulcer can lead to the presence of blood in the stool, which may appear dark or tarry. Diagnosis of peptic ulcers. Diagnosing peptic ulcers involves a combination of medical history assessment, physical examination, and diagnostic tests. Common diagnostic approaches include 1. Endoscopy. An endoscopy is a procedure in which a thin, flexible tube with a camera is inserted through the mouth to visualize the stomach and duodenum. This allows for direct examination of the ulcers and collection of tissue samples for biopsy. 2. Barium contrast X-ray. A barium contrast X-ray involves drinking a chalky liquid containing barium, which coats the digestive tract. X-rays are then taken, revealing the presence and location of ulcers. 3. Blood tests. Blood tests can detect the presence of H. pylori antibodies or signs of anemia, which may result from bleeding ulcers. 4. Stool tests. Testing stool samples for the presence of blood can indicate internal bleeding from ulcers. Complications of peptic ulcers. If left untreated, peptic ulcers can lead to serious complications. Some potential complications include 1. Internal bleeding. Ulcers can erode blood vessels, leading to internal bleeding. This can result in symptoms such as bloody or dark stools, and in severe cases, can lead to anemia. 2. Perforation. A deep ulcer can create a hole in the stomach or duodenal wall, allowing stomach contents to leak into the abdominal cavity. This can lead to a life-threatening infection known as peritonitis. 3. Obstruction. Scarring from long-term ulcer disease can narrow the passage leading out of the stomach, causing an obstruction. This can result in vomiting and weight loss. Treatment of peptic ulcers. The management of peptic ulcers involves a combination of medications, lifestyle modifications, and, in some cases, surgical intervention. 1. Antibiotics. For ulcers caused by H. pylori infection, a course of antibiotics is prescribed to eradicate the bacteria. This often involves a combination of antibiotics and acid-reducing medications. 2. Proton pump inhibitors, PPIs, and histamine 2, H2, blockers. These medications reduce stomach acid production, providing relief and promoting ulcer healing. PPIs like omeprazole and H2 blockers like ranitidine are commonly prescribed. 3. Cytoprotective agents. Medications that enhance the protective mucosal lining of the stomach, such as sucralfate, may be used to aid in healing. 4. Lifestyle modifications. Patients are often advised to make lifestyle changes, including quitting smoking, moderating alcohol intake, and avoiding NSAIDs to prevent exacerbation of ulcers. 5. Surgery. In cases of severe complications or if medications are not effective, surgical intervention may be necessary. Procedures may include removing the ulcer, repairing perforations, or addressing complications like obstruction. Peptic ulcers, once thought to be solely related to stress and diet, are now understood to have multifactorial causes. Advances in medical research and diagnostic techniques have provided a clearer picture of the contributing factors, enabling more effective treatment strategies. Early diagnosis and appropriate medical intervention play a crucial role in managing peptic ulcers and preventing complications. Additionally, lifestyle modifications, such as adopting a healthy diet and avoiding known risk factors, contribute to long-term ulcer management. Individuals experiencing symptoms suggestive of peptic ulcers should seek prompt medical attention. Through a collaborative approach between healthcare providers and patients, the impact of peptic ulcers on individual health can be minimized, allowing for a better quality of life.